So at Hinduja Hospital, we are looking at all the ways in how to improve the delivery, clinical delivery to the patients. So for that, one of the trends which is helping us is the emergence of digital technology. So we are looking at means of giving healthcare through digital means, so digital healthcare delivery. We are looking at technology options to make it more easy and convenient for patients to access the healthcare in the hospital from home, within the hospital, and after leaving the hospital. So the patient journey is being evaluated to see how it becomes more efficient and more clinically oriented, and the patient does not lose out on the doctor touch while using the technology. The other thing which is helping us and we are evaluating is the latest trend of emergence of AI in healthcare. So we are looking at options that can we use AI to look at more patients with the same number of clinicians. So if I can help more patients, it will be good for the country, it will be good for us. The other thing which we have also looked at is when a patient comes to the hospital, the patient and the relatives are in any case under quite a lot of stress. So if I can use technology to make their life simple, make sure that the simple questions they have in their mind, if they are answered through technology, the conveniences are taken care of. They don't need to run around from pillar to post to take care of things. So if I can get things in their hand digitally, that will really help the patient care. From the clinician perspective, we are looking at ways in which I can make clinicians' life better. In the sense, for example, can the discharge summary be easily done through digital means? Whether they don't have to write, can they dictate? Can they do things digitally? Can the records be accessed? Can the clinician access the radiology image in his OPD room or even outside the hospital and look at the patient reports and then give suitable advice? We are also looking at ways in which the patient can access their reports from anywhere in the country, download it on their phone, and share it with their clinicians wherever they are. So we are trying to use the technology in all aspects. However, having said that, nothing will be complete without the enhancement of clinical excellence in any hospital. So we are looking at, the biggest trend in the country is the oncology is growing on the non-infectious diseases like diabetes, obesity, etc., cardiac, they are growing. And what we are doing is to look at making oncology, cardiac sciences, our orthopedic services, our neurosciences, and obs and gynec as maternal and childhood as a center of excellence. So what I mean by that is that we look at a holistic way in which I can enhance clinical excellence through adding of multiple subspecialties, adding super specialists available in any in any part of the treatment required for those diseases, looking at the suitable infrastructure, looking at the latest technology from across the world, looking at how I can enhance the patient experience when they come to any of these things. So that broadly is our focus going forward in the next few years. So, it is too soon to give you a feedback from the doctors. And so I'm not so sure if I can tell you that I have asked the doctors and this is what they say. But I have a personal view, which I request the government and the regulatory authorities to think about. It is that when the doctor prescribes a medicine, he or she has obviously looked at the clinical efficacy of all the brands and for the molecule. And he's comfortable with that. And he or she is responsible for the patient's treatment. And he gives that medicine. So we have the choice of the medicine to be prescribed to the doctor. The moment I say generic, so the choice of which medicine which the patient will get shifts from doctor to the pharmacists. And I have nothing against pharmacists. Pharmacists are a great help to the hospital community, to the doctors, to the patient. But it is a normal tendency for any businessman to maximize their profit. And if a particular medicine gives them more margins, it is a normal tendency to sell more of that. Now, whether the doctor is comfortable with that medicine, whether that is efficacious, that has to be looked at. So I think the choice of the medicine to be prescribed needs to be given to the doctor. The second thing is that we know that there has been some data in the country about how many medicines are spurious drugs. So I know the government and the DGCI are doing all possible steps to look at these fake drugs and testing. But India is a large country and there are many manufacturers. So I think there is some more work to be done there. And from the doctor community, I think it doesn't give them confidence. And I say that if the doctor is not confident that the treatment he or she is prescribing to the patient will get the patient better, I think that is not okay. And the last thing I want to say is that the generic medicine is a wonderful initiative because it gives a low-cost option to the patients. But unless we measure and have the data for all the generic medicines on the efficacy and safety of all those, it will be difficult for the doctors to prescribe. So we should do that. We should get all of them tested. We should get the data. And once that is done, I'm sure the doctors will be able to prescribe.